Thank you for joining us today, everyone. My name is Bree Flanagan. I'm one of the health educators here at the Caldwell County Health Department, and I'm joined today by Tyler Wunderlich, one of our other health educators. And we're going to be asking some questions to Chad Barr, the communicable disease and tuberculosis nurse of the Caldwell County Health Department, and Stephanie Feemster, the UNC infection prevention nurse. So today we're going to be talking about respiratory illness and some other emerging illnesses that you may have seen on the news so far. And when you guys are ready, we're going to jump in and ask you some questions. Good
Okay.
with that? All right, perfect. So my first question is, what is respiratory illness? Can you kind of give me a definition of what that is?
Sure, Bree. Well, thank you for having us today. And so respiratory illness can be, both viral, like our typical upper respiratory infection, rhinovirus, influenza, or COVID-19, or it can be like a bacterial illness, including pertussis, haemophilus influenza, or legionella. And a respiratory illness is considered any illness that affects the lungs and makes, or really the lungs or the airways, and makes breathing more difficult.
So some of the most common symptoms that we look for in a respiratory illness are your cough, your runny and stuffy nose, sore throat, fever, body aches, and fatigue. For infants and children, there may be some other symptoms such as stomach aches, nausea and vomiting, or diarrhea. A person may also experience symptoms of shortness of breath, chest tightness, or wheezing. These symptoms can range from mild cold-like illnesses to more serious breathing issues. So there are several risk factors that can increase the risk of severe respiratory illness and hospitalization. Age is one of the biggest contributors, especially older adults and very young children. Chronic conditions such as asthma, COPD, heart disease, diabetes, kidney disease, these can limit the body's ability to fight infection. Individuals who are immunocompromised, such as those including cancer or on immunosuppressive medications, are also at a higher risk. Other factors to consider are smoking, vaping history, obesity, and just poor overall health. We look at some of our social environmental factors as well: crowded living situations, lack of access to health care, and just being unvaccinated could all worsen these symptoms. When these patients develop symptoms such as like low oxygen, increased shortness of breath, confusion, dehydration, persistent fever, these patients are more likely to be admitted to provide supportive care and close monitoring. Anyone who has trouble with breathing or the persistent fever, confusion, or symptoms that are getting worse should always seek medical attention.
Okay, that's good to know. Thank you.
All right, so next question for you guys. Let's talk about the what and where, the state and the region, and some of the local things that we're seeing with respiratory illness and whatnot. Can you share a little bit on that with us, please?
Sure. So emergency department visits for influenza-like illness, that includes, really all respiratory illness, including RSV, influenza, rose sharply beginning week 48 of 2025. That was right around the Thanksgiving time. It continued a sharp trajectory, and we think we reached our peak around week 52, and that was around December the 28th, right around Christmas. So you can see in slide 1, the red indicates the 2025 to 2026 influenza-like illness season that we have began to decline as of week 1 and week 2 of 2026.
Excellent. And then more on the local.
Yes. So during the current respiratory season here in our local clinics, urgent cares, and emergency departments, we've primarily just seen flu A. Since October, between the clinics and urgent cares and emergency department, we have had over 1,800 positive cases of the flu.
Wow.
Yes.
Yeah. Make sure you're washing your hands.
Yes. Hand hygiene.
All right. So for the next question, we tend to see these kinds of illnesses increase during the fall and winter. Can you tell me more about why that is?
Sure. So it's thought that respiratory illnesses increase in the fall and winter because of both behavioral and biological factors. As the weather gets colder, people tend to spend more time indoors in close proximity to one another. And not only that, The cool air and the lower humidity decreases our nasal immune defenses, and viral particles are thought to be able to travel further in low humidity, increasing the risk of transmission of those illnesses.
It's good to know. So our next question is, how can we prevent these illnesses?
Yeah, so vaccines are, of course, always the most recommended for prevention. Vaccines are highly effective at preventing respiratory illnesses. They can shorten the duration of illness, and they can lessen the severity of the illness. So childhood vaccines can be administered at your local pediatrics offices or the local health department. And North Carolina has a great website called Vaccine for Children, or VFC. And this website is a great resource for parents or for guardians. It provides information for recommended vaccines, eligibility on how people can get free vaccines, and there is an interactive map to assist parents and guardians in the finding VFC providers throughout the county.
Okay, that's good to know. And of course, like Chad said, the health department's always a good option, so come see us if you need a vaccine.
That's right.
Yes.
All right, shifting gears a little bit, let's talk about emerging illnesses in the community and whatnot. So, Chad, can you give us a little bit more on that emerging illnesses that we're currently seeing?
Yeah, so, when you turn on the evening news, it seems like we're hearing more and more about illnesses that we've not talked about or seen recently here in North Carolina. And, illnesses wax and wane in geographical locations due to several factors. With the recent measles outbreaks in South Carolina, we've heard a lot about herd immunity. Herd immunity occurs when a certain proportion of the population develops immunity to an illness, and that can either be from infection and recovery or through vaccination. This immunity creates an invisible wall, if you will, and prevents the disease or the pathogen from spreading because there's not enough susceptible host to continue that transmission chain. Other factors that can reduce disease spread is environmental changes. For example, there's less vector-borne disease. That would be like, tick-borne or mosquito-borne illnesses in the fall and winter months than what we see in the summer months. And then finally, public health interventions include the assurance of safe food and safe water. Vaccination programs done by local health departments and private offices help populations to avoid outbreaks within our communities.
Excellent. Those are all wonderful things. Thank you for sharing those.
Now, Chad, you mentioned measles earlier. Can you tell me what's going on with that?
Yeah, so measles is one of our most infectious communicable diseases. It can be passed easily from person to person through the air, and it's so infectious, Bree, that one person can infect up to 90% of the people around that person if they are not immune. So measles tends to move very quickly once it enters into an area with low immunity. For example, in the South Carolina outbreak, on January 2nd, South Carolina Public Health reported 185 cases of measles. 4 days later, on January the 6th, they reported 211. And by January the 9th, only 3 days later, 100 more cases brought the total to 311. And as of January the 13th, South Carolina public health officials were reporting 434 cases of measles.
Oh, wow.
Geographically, North Carolina is very close in proximity to this outbreak and has reported 5 measles cases so far. And all of these measles cases have been associated with the South Carolina outbreak. So Caldwell County Health Department, as well as state officials, are encouraging individuals to ensure that they are protected against measles before they travel internationally or before they travel to a location with a current measles outbreak. We encourage everyone to ensure your MMR vaccines are current. And if you or your child need MMR, measles, mumps, and rubella vaccine, you can visit the Caldwell County Health Department, the pediatrics offices within the county, and the primary care offices throughout the county. Now, the first dose of MMR is thought, Bree, to provide around 93% immunity and protection. But individuals who receive the second dose, that increases to around 97% effectiveness. That means 97 out of 100 people will achieve immunity with 2 vaccines of MMR.
That's pretty good.
Now, to check your children's immunization status or your immunization status, you can call your primary care provider or the Caldwell County Health Department. For more information about this, you can go to the website that we showed earlier, the North Carolina Department of Health and Human Services Vaccines for Children website. And there you can find what's recommended as well as eligibility and where locations where you can get those vaccines.
Okay, that's really good to know.
Unfortunately, if you're identified, if we were to have a measles case in Caldwell and you are identified as a contact and you're not able to provide proof of measles immunity, you would certainly be able to get the MMR vaccine, but you would also be required to quarantine away from others, and the quarantine period is 21 days. So that's a long period of quarantine.
It is. So best to get your vaccine if you can. We don't want to be getting others sick.
Yeah, and ensure that you can prove that you're vaccinated,
Yes.
Not just word of mouth, I think, or I was told I was vaccinated. Make sure that you're able to find your actual vaccine history.
Thank you, Chad, for sharing. Stephanie, can you tell us more about the signs and symptoms of measles or other things to watch out for?
Yes, absolutely. Measles begins with what we call in the medical field a prodromal stage, which is your early phase. Usually it's 2 to 4 days before that measles rash appears. During this period, this person develops symptoms often resembling your common cold, your runny nose, your cough, your congestion, your itchy, watery eyes. Sometimes they may get the white spots in their mouth. Those are called Koplik spots. Those are a classic early sign of measles. Those are not to be confused with strep throat. Strep throat is more like blister types in the mouth. These are really tiny little white spots in the mouth, and we have a picture to show that, I think.
Okay.
What we want to educate a person on is measles is highly infectious, and it starts 4 days before the rash even appears and remains contagious until 4 days after the rash begins. Because the early phase symptoms are so nonspecific, individuals may unknowingly transmit the virus through airborne droplets by coughing or sneezing before measles is even recognized. Therefore, we try to do early identification, and isolation is critical for those individuals. And I've mentioned several times about the rash, and a lot of parents and families get confused when they're like, okay, he's got a rash on his arms, on his legs. Measles rash will typically start on the face, and it'll move down the neck and to the trunk of the body. But it's typically you'll see those on the face first before anywhere else.
That's good to know.
Yes, and if you feel, one of the biggest things I'd like to stress to the community is if you feel like that you may have the measles or been around somebody and you want to go and get checked, try to call your local urgent care or clinic or emergency department that you're going to, just to kind of give them a heads up so that they can know to take the necessary precautions when you get there, to where you're not sitting in a lobby or waiting room exposing others to a potential case.
Right, absolutely. Want to keep everybody safe.
Yes.
Yes. Okay. Thank you, Stephanie.
Welcome.
Yeah.
Well, thank you all for that. Let's shift gears a little bit here and talk about some treatment options. So what can people expect with treatments, things of that nature?
Okay. So treatment really depends on how long the symptoms have been present and what viral or bacterial is found on the test itself. Antivirals is normally prescribed for your influenza and your RSV. Antibiotics is typically prescribed for your pertussis, your haemophilus influenza. You don't normally get antibiotics for viruses, though. Those are, we typically leave those for the bacterial infections. Some of the other things that we can do is over-the-counter medications. You can take like Tylenol, ibuprofen for your fever or body aches, saline nasal sprays, or Mucinex. Over-the-counter guaifenesin is good for sinus congestion and pressure. Unfortunately, for most respiratory viruses, they're just going to have to run their course, which is typically about 7 to 10 days. So any questions that you ever have, though, about medicines or what you should take, or if you need to be seen, always refer to your primary care doctor or your physician before taking anything.
Of course, yeah. Got to check first.
Yes.
All right. And then last point we're going to talk about today is just going to be some prevention measures. What can people do to kind of get ready for things and make sure that, they're kind of ahead of the game and hopefully not getting any of this, because we don't want anyone getting it if we can prevent it, obviously.
Well, as the CEO of UNC Health Caldwell, Dr. David Lowry, loves to say, hand hygiene is the number one thing we can do to prevent the spread of respiratory illness, any illness. Other things you can do is, if you're feeling sick, stay at home. Don't go expose yourself to the public. Cover your coughs when you're sneezing or coughing. Avoid close contact with others who are ill. If mask is recommended, wear your mask. If you have been diagnosed with a respiratory illness, practice isolation. Stay away from others who are not ill. If you've been exposed to someone, isolate for about 5 days to make sure you don't have any symptoms that arise. Doing those simple things, that can help protect not only yourself, but our community as a whole.
Yeah, very simple things, but make a huge impact for sure.
Yes,
Yeah.
yes.
All right. So, any final closing thoughts just to wrap things up here? Any second thoughts that you may want to touch on again or anything of that nature?
Yeah, so thank you, Tyler, again for having us on. And on behalf of the Caldwell County Health Department and Public Health, we want to thank you, our public, for your support and your involvement as we continue to promote, protect, and improve the health of our communities. If you have questions about our topics today, about respiratory illness, measles, feel free to reach out to us at the Health Department. You can call me directly at 828-426-8534. And I'm sure that UNC practices, the urgent cares, the pediatricians' offices, they can also answer your questions as well.
Yes, they can.
All right, Stephanie, do you have any closing remarks you'd like to make?
Just thank you for having me and let me represent UNC Caldwell.
Of course, thank you both for being here and for sharing all of this valuable information. I think it'll make a huge difference for the community. And Tyler, thank you for hosting with me.
Yes, of course. Always good to be here. Hopefully
Yes.
going to do a lot more of these things and make sure that everyone's staying nice and healthy.
Yes, thank you guys for joining us. Have a great rest of your day.